Welcome to the podcast Sophie au pays des possibles, the first podcast in French about the women and men who combat corruption and tax evasion. My name is Sophie Lemaitre, I'm the host of the podcast. Today's episode was recorded in English. My guest is Daniela Cepeda Cuadrado, Senior Advisor at UFO Anti-Corruption Resource Center based in Norway. In today's episode, we discuss the links between corruption and health. Hi, Daniela. Welcome. Thanks for joining us. Could you please tell us a bit about yourself?
Hi, Sophie. Thank you so much for the invitation. I am Daniela Cepeda Cuadrado. I'm a policy analyst and trainer, currently working as senior advisor at the U4 Anti-Corruption Resource Center, where I lead portfolios in health and human rights. Part of my work includes conducting research, providing and facilitating learning and training initiatives, offering policy advice, and engaging with local, regional, and global stakeholders on how to promote and support corruption mitigation strategies. I've also had the opportunity to do this in different sectors as part of the UN system and previously as well as part of Transparency International, which is a leading civil society on anti-corruption.
Thanks, Daniela, for your introduction. As I said, today's episode is about corruption and health, and we see that corruption is prone in the health sector. Why is it so?
There are different characteristics of health systems that make them very, very vulnerable to corruption. The first one is that in health systems, in the health sector, it is very difficult to know who will fall ill, when, and how. So this uncertainty creates a space for decision-making processes that can be opaque and that can contribute to creating an environment where corruption could flourish. There is also the fact that there are a multitude of actors. We have the private sector, we have the public sector, we have patients, providers, suppliers, regulators, all involved in the health system. And having such a number of actors also makes it very difficult to monitor and to establish transparency and accountability mechanisms in place in all their relationships. And connected to this too is the fact that there is also information asymmetry, which means that not all actors have the same information, and some actors can use the information that they have to promote their private interests. So, for example, and I'm not saying this happens everywhere, but for example, when you go to the doctor as a patient, you must trust that your health provider, that your doctor provides you with the right treatment, with the right medication for your situation. But there are cases where doctors may prescribe medications that have been promoted by pharmaceutical industries to them, and they may not be the best treatment for you. So again, having information asymmetry among different actors, having so many actors involved in the health sector, and understanding that the health sector is quite a space where uncertainty prevails, this makes the health system very vulnerable to corruption.
The risk of abuse of position and abuse of power, I imagine.
Exactly.
So what are the main forms of corruption in these sectors? And could you give us examples so that we can really see what corruption looks like?
Sure. So there's so many different forms of corruption that impact health systems. And there are no types of corruption that are, in my opinion, more prominent than others. It all depends on the context and the vulnerabilities that each health system has. But one approach that I have found really helpful to categorize and to identify different forms of corruption is looking at it through the health system's building blocks. The health system's building blocks is a framework developed by the WHO to be able to understand how health systems work. And health systems can have 6 blocks: service delivery, financing, governance, human resources, health information systems, and medicines and vaccines and technologies. And the well-functioning of all these 6 blocks together ensures that the health system works properly and can provide accessible and quality care to patients, to people. So what happens in this space? Corruption can infiltrate, can have an impact on all these 6 building blocks. We can see, for example, petty corruption like bribes, informal payments, and sextortion at the point of service delivery. We can also see procurement corruption and embezzlement in financing. We have seen as well state capture that influences governance, nepotism and patronage in the recruitment and management of human resources, data manipulation affecting health information systems, theft, and the proliferation of substandard and falsified medicines, compromising the quality of medicines, vaccines, and technologies. But these are just a few examples of the many different ways corruption can infiltrate all these six components. And the key message here is that any type of corruption affecting any building block can have and will have an impact on all the other building blocks because they're all interrelated. If you have corruption, if you have manipulation of data and health information systems, that also has an implication on governance and on the data that you can use to strengthen your governance structures in the health system. But again, as I mentioned at the beginning, in terms of what is more common, it all depends on context. So, for example, there was a study in 2023 which conducted a rapid literature review to identify, describe, and classify cases of health corruption presented in 4 countries in Europe, 2 in Western Europe, the Netherlands and the UK, and 2 in Central Eastern Europe, Poland and Slovakia. And according to their findings, the primary type of corruption in Western European countries were procurement corruption, while misuse of high-level positions was the most prevalent in Central and Eastern European countries. So what it's important to take here is that the nature of corruption makes it very challenging to identify and report corruptions in the first place. They mentioned that this is one of the reasons why there may be some publication bias in these results. But in a nutshell, when we looked at what is prevalent in the health sector, we really need to look at what drives it according to each country's and each local context.
Thank you very much. It was really clear with these 6 blocks. I was wondering if you could give us more specific examples. So you mentioned petty corruption and bribe in the first block, service delivery. So how would it look like? And then you mentioned procurement corruption. What is it exactly? If you could give us just some snapshot, concrete ideas of how it is in practice.
When we look at, for example, petty corruption in service delivery, we're concerned about the ways, the dynamics between providers and patients. And we can see different forms of corruption happening there if there are no proper monitoring and accountability mechanisms in place. So, for example, the issue of bribes and informal payments are a key concern worldwide. And we can see that there are specific groups that are more vulnerable to this type of corruption. Let's take, for example, women. Women due to specific health needs, but also the fact, the gender roles that makes it so that they are responsible for their needs of their families too. These conditions makes them more likely to be in contact with providers more than other groups. That also raises their likelihood of experiencing moments where they've been asked to pay either in currency or in sexual favors to be able to access services. We also see, for example, and we saw this during COVID-19, that we can see bribes and queue jumping to access key medical products at a time of need. During COVID-19, we saw queue jumping from politicians, seniors, and high-level government officials happening in Malaysia, Philippines, Peru, Argentina, Spain, Poland, Canada, and Ecuador. Of course, their prime access to these vaccines made it very difficult for other groups that needed it the most, for example, health workers at the front lines. So these are a few examples of service delivery. Procurement is also a very, very vulnerable area to corruption. And because the health sector tends to get considerable budget to finance its operations, it is very, very likely that if there are no accountability mechanisms in place, that there can be corruption in procurement. Again, I can give you a few examples, more recent examples from COVID-19. According to our research in 2022, we found that in Africa alone, approximately $1.78 billion were spent and lost in corrupt procurement deals. But we don't only see this in developing countries, we also see it in high-income countries like the UK, where Transparency International found that almost 2/3 of contracts related to the purchase of protective personal equipment were awarded to firms that were part of a special VIP lane without following due diligence. So these are a few examples of these cases, but of course we can go further on the other ones too.
It really gives an idea of how corruption looks like. And thank you for the different situation. I also hear that no region is without corruption. Sometimes we may have this stereotype that maybe corruption in the health sector may happen only in certain regions or in certain countries, but you gave examples with the UK, and we see that's around the world. Is that also your understanding?
Yes, I agree. I completely agree. I would like to add more nuance to that statement because I do understand that to mitigate and to address corruption, we need strong health systems. And one key part of having strong health systems is having adequate governance structures in place. That means policies for regulation, for financing, for coalition building, and for accountability mechanisms. But these can be quite expensive to establish, to implement, and to monitor. And creating, establishing, implementing regulatory bodies and conducting enforcement, that requires funding. So yes, when there is research saying that higher income countries may have larger tax bases to finance and implement governance systems that can be strong yet flexible enough to address emerging corruption threats, there is true in that too. But having said that, the fact that a country can have more income to invest in enhancing a health system's governance doesn't mean that they will do it entirely. And even if they did, it doesn't preclude them from experiencing corruption because all health systems have vulnerabilities that expose them to corruption. So, for example, there is ample research showing how the pharmaceutical industry has had a huge influence on the development of health policies and approval of medical products in the US. The revolving door between pharmaceutical industries and lawmakers in the US is a clear example of collusive relationships. There is one study from the Food and Drugs Administration that found that the majority of drug reviewers in the hematology oncology over a 10-year period had left the agency to work for biopharmaceutical companies. So there are huge conflicts of interest that are not addressed and that can create a very fertile ground for corruption. We also see these in mental health policies too. And there is a researcher in this space, her name is Dr. Lisa Cosgrove, who wrote a book about institutional corruption in the mental health sector that provides a lot of examples on how the industry has influenced regulatory decisions, public perceptions through patients' groups, and influencing the medical products that are then delivered to the population.
Now I'm curious. Can you give us an example regarding mental health?
Sure, Sophie. So there is one example that she provides in a 2015 article that she wrote with two other experts. I found it quite interesting. So she mentions that there is this company called Sprout Pharmaceuticals that created a medicine called flibanserin, but the FDA could not approve it as an antidepressant because of lack of efficacy data. And instead of accepting that, the company decided to promote it as a treatment for a highly controversial female hypoactive sexual disorder. In their campaign, they created a fictitious feminist group called Even the Score. And in their promotional campaign, they said, men had numerous sexual health drugs like Viagra, but women had none, hence the need to even the score. And their campaign was very successful. They were able to promote the drug under the guise of gender equity and sexual health. And because of this promotion, the FDA approved it in 2015. And then the drug, within 40 hours after approval, the drug was sold to another pharmaceutical for $1 billion. And this all happened despite the fact that at the beginning, FDA had not approved it because they found it to be a failed antidepressant.
This example really highlights the heavy influence and lobbying techniques used by some companies. Earlier, you mentioned a couple of examples during COVID-19. So a related question is, to what extent does corruption exacerbate health crises such as pandemics like COVID-19 or emergencies?
Yes. What I think is that corruption has always existed in the health sector, right? Like the health sector is a place where there is a lot of uncertainty, where there are multiple of actors involved that makes it hard to monitor. And also there is high information asymmetry. And this makes it so easy for unscrupulous actors to commit corrupt acts. But during health emergencies, there are also additional characteristics that exacerbate the vulnerabilities of health systems to corruption. One of them is that in the name of expediency, countries tend to slow down complex processes and procedures to ensure transparency and accountability. There is here a higher likelihood that contract awards go through non-open procedures such as single bidding and shorter advertising periods. There is also the fact that countries during emergency times can experience increased financing, but their health systems have limited absorption capacity. And this sudden influx of funding and lack of clear emergency response plans forces many governments to relax safeguards meant to protecting against conflicts of interest, collusion, and fraud. So the failure to absorb this funding creates opportunities for undue influence, for bribery, for price gouging, and for the proliferation of substandard and falsified medicines. Third is the fact that health emergencies lead to a surge in demand for medical supplies, but supply chains are not always ready to respond to the sudden demand. So, in the case of COVID 19, the COVID 19 vaccine supply chain faced significant challenges due to limited numbers of manufacturers, poor coordination with local organizations, weak monitoring systems, difficulties in temperature control, high costs, and lack of financial support. And these made vaccines distributions inefficient, complicated the rollout process for many countries, and created opportunities for corruption. There is also the fact that history has shown that there is lack of or poor preparedness and planning for responding to health emergencies. During the Ebola crisis in West Africa, there were cases of fund diversion, salary misreporting, and bribes to bypass containment measures. In Indonesia and Sri Lanka, favoritism and patronage networks turned out to be controlling when the allocation of relief materials during the 2004 tsunami disaster. And while these cases happened before COVID 19, they did not inform approaches to strengthen health systems in the global response to COVID 19. So we continue to make the same mistakes as had happened in the past. And lastly, we see that previous corruption can weaken health systems governance and lead to a protracted crisis. So there is this news article from Colombia that I found very interesting that highlighted this. And here, an independent digital newspaper revealed that the theft of $6.5 million by a state official, which at the time was destined to provide healthcare for an indigenous group before the pandemic, if that money wasn't stolen, that could have been used to buy between 241 and 322 intensive unit beds and ventilators during the COVID 19 pandemic.
That's crazy to see that we're not learning from past mistakes and we're just repeating the same thing at every crisis. That's just heartbreaking. We kind of touched it, but more like implicitly looking at the impacts. So, what are the impacts of corruption on health systems and on the delivery of healthcare services, and at the end, on us citizens?
Fighting corruption or addressing corruption is not an end in itself, it should be a means to a higher end. And in the case of the health sector, addressing corruption is key to ensure that we can improve public health outcomes and to ensure that people can exercise their right to health. The fact is that corruption has a huge impact on health systems because it deprives it of the resources needed to provide quality, accessible, acceptable healthcare to people. And by resources, I not only mean an impact to financial resources, I also mean an impact to human resources, to the infrastructure, to the medicines, vaccines, and technologies that need to be in place for health systems to function. Corruption represents a threat to all of this. But in doing so, corruption also creates an indirect impact because by reducing the resources needed to operate efficiently and effectively, corruption can lead to poor health outcomes and can represent for many people the difference between life and death, especially for those patients who are in a situation of vulnerability and cannot access health services at the moment of their need because of corruption. So corruption can also represent a threat to the right to health. There are also several studies that have shown that there is an association between corruption and specific health outcomes. For example, corruption has been associated with decreasing HIV treatment coverage and with increasing antimicrobial resistance.
And to end this episode, let's look maybe a bit on the bright side. What are some promising anti-corruption initiatives?
I like that question. And I think that's the most challenging one to answer, because corruption is so pervasive. It is very difficult to eradicate and to find successful, sustainable anti corruption initiatives in the health sector. So, having said that, there are plenty of initiatives happening, bottom up approaches and top down approaches that are looking to address and to mitigate the risks of corruption from happening in the health sector. And to me, I think the most impactful initiatives are those that focus on what drives corruption at a specific time and context, to identify where the vulnerabilities lie in the health system, who are those impacted, and devise strategies that address those specific drivers. I can give you an example of what I mean by focusing on the drivers of corruption, how it impacts people, and identifying those vulnerabilities to address them. So, one clear example of these is absenteeism. Absenteeism is a huge problem across the world. We see cases where, in Bangladesh, for example, where the population ratio is 18 doctors to 10,000 people in urban areas and one doctor for 10,000 people in rural areas. This is a study done by Professor Hutchinson and other scholars. What they show is that, the reason why doctors are not going to their posts is not because they want to be corrupt. It's also because there are different concerns that are going through their heads. One of them can be safety concerns. It can be that doctors don't feel safe in their posts, that the community is intimidating them to provide, for example, fake medical certificates. It might also be that there's some gender components of this safety concern, that women, for example, feel scared to go to the posts if there is no lighting or if there is no good transportation at late hours of the night. So to address absenteeism, which we identify as a corrupt act, we don't necessarily need direct anti-corruption interventions. We can have interventions that address what drives them not to go. So we can look for other policies and other strategies to improve the quality of the workplace. For doctors, we can look into their salaries, because sometimes doctors also may be engaging in absenteeism because they have to go to another place to make ends meet as well. So we can address that form of corruption by looking at what is driving it, addressing all the other aspects that may not necessarily require direct anti-corruption intervention. We can also look into power dynamics. Sometimes there are doctors, health workers that feel confident not to go to their posts because they have a patron, their proteges from a political leader, and they know that they won't face consequences if they don't go to their posts. And there is some research in Nigeria that has shown that in these cases, what it might be helpful, it would be to talk to community leaders who are also respected, to the traditional ruler, so that they can intervene and ensure that absent workers change their behavior. So you can also look into what other sources of power there are and devise strategies to correct the corrupt act. There are also different strategies, from bottom-up approaches to top-down and technological advances. But in my opinion, what I find that the most impactful are those interventions that think about why corruption is happening in the first place and what can we do to remove the conditions that enable corruption to thrive. And in many cases, removing these conditions doesn't require us to engage in sanctions or in direct anti-corruption policies.
Great. Thanks so much, Daniela, for this very insightful conversation and giving us an overview of the links between corruption and health. That was very useful, and I hope it will give a better idea to our listeners. So thanks again for today.
Thank you, Sophie. It's been a pleasure.
Thank you for listening to this episode. Share it with your network, friends, family, and colleagues to help spread the word. If you enjoyed it, you could listen to my other episodes recorded in English. Episode 19 is about the Corruption Hunter Network, a network of anti-corruption prosecutors and judges from around the world. Check out also my episode with Niels Kurbis on corruption and artificial intelligence, as well as with Pusetso Morapedi on the creation of an international anti-corruption court. If you understand or speak French, take a look at the 45 plus episodes available. And if you can leave me a 5-star recommendation, that would be fantastic.